Hello, and thank you for viewing this presentation. My name is John Crouch, and I am the Clinical Services Coordinator at Behavioral Health System Baltimore, the local behavioral health authority in Baltimore City. Today's presentation will be an overview of the Residential Rehabilitation Program in the city. BHSB is a nonprofit organization tasked by Baltimore City and the Behavioral Health Administration to perform the function of managing the city's behavioral health system, which includes services for individuals with substance use and mental health disorders. This slide provides an overview of our vision, mission, and values. As the local behavioral health authority, we help guide approaches to prevention, early intervention, treatment, and recovery in a number of different ways, which include influencing policy development through state-level advocacy, raising public health awareness about behavioral health issues across the city, partnering with local agencies such as the police department, city schools, housing authority, the mayor's office, and the health department, and allocating resources for substance use disorders and mental health services to Baltimore service providers, primarily through grant-funded programs. To give some context of the larger system that we're a part of, the Maryland Department of Health, which is a state organization, oversees all of Maryland's health services. The Behavioral Health Administration is a division of MDH, which oversees behavioral health services in Maryland, encompassing both mental health and substance use disorders. And then BHSB, which is the local behavioral health authority. And then we have our behavioral health organizations, which provide the direct service in the public behavioral health system. These services are for individuals with Medicare, Medicaid, or uninsured individuals. This does not include anyone with private insurance. And then we have our individuals, families, and communities, the recipients of these services. Now let's dive into the main topic of our presentation today, the Residential Rehabilitation Program. RRP is a resource for adults who require intensive support services in a structured living environment. Individualized goals are developed with the participant and may include medication monitoring, development of independent living skills, symptom management, stress management, and relapse prevention planning, as well as linkages to employment, somatic care, education or vocational services, crisis services, and any other supports that are designed to help with the individual's recovery. It is important to note that RRP is not considered permanent housing. It is meant to build skills and support rehabilitation, allowing the individual to thrive in a more independent housing setting. RRP should only be considered an option for those who have the potential, while in this temporary setting, to build skills and rehabilitate to the point of being able to transition to a less intensive, more independent setting. RRP programs are offered in 2 levels of support by 8 providers within Baltimore City. We have the general level support, where staff provides a minimum of 3 face-to-face contacts per individual per week. Staff is also available on call 24/7. At the intensive level, staff are on site 7 days a week, providing a minimum of 40 hours of face-to-face contact. Staff are also on call 24/7. Members being referred from the community with a high level of need may require this service. Anyone discharging out of the state hospital is automatically referred to an intensive level RRP. It is important to specify when you are requesting 24/7 on-site support for a referral and to justify the need for 24/7 on-site staff support. While each program has staff on call 24/7, not all homes have awake overnight staff support. The criteria for RRP is as follows: a history of criminal behavior, substance misuse, aggressive behavior, psychiatric hospitalizations, psychosis or poor reality testing, and the individual is currently a safety risk to themselves, exhibiting active psychotic symptoms, impulsivity, impaired judgment, inability to manage medications independently, or aggressive behaviors. Additionally, the individual has inadequate or no housing, less intensive levels of care in the community have not been successful. The individual must have a priority population diagnosis, which are listed on the referral form. They must be clinically ready for the program, and they must be agreeable to enter the program and follow the rules designated by each provider. It is important to note that there is often a wait list for intensive beds. If referring from a community hospital, social workers should attempt to submit the referral in advance of the projected discharge date to ensure the length of stay is not prolonged. For intensive level openings, state hospital discharge referrals take priority. Thus, for community referrals, it is important to get your referral in as soon as possible. When filling out the referral, please include as much detail as possible, specifically in Section J, which covers the information needed to ensure that medical necessity criteria is met. Information in this section includes diagnosis, history of psychiatric hospitalizations, justification for an inadequate support system to provide needed residential support and supervision, information about the individual's ability to cooperate with rules and supervision, demonstrating that less intensive levels of care have been determined to be unsafe or unsuccessful, and listing the past and present behaviors of concern and describing those behaviors. When describing any high-risk behaviors, please provide as much detail as possible about the most recent occurrence, frequency, or potential triggers. Ultimately, it is up to the provider reviewing the referral to determine if an applicant is appropriate for their program based on their current presentation, their history, and the milieu within the residential program. Individuals may choose up to 3 additional counties or jurisdictions to send the referral to. They must indicate this on the consent page found within the referral. The referral is still initially sent to the individual's county of origin, and if they are from Baltimore City, BHSB would then release it to another county or jurisdiction for review. For example, if a Baltimore City resident wants to live in Howard County, the referral is sent initially to BHSB as the county of residence, and we will then release it to Howard County after it's reviewed and approved. Counties prioritize their own residents when reviewing referrals, so please keep that in mind. As was just mentioned, referral forms are sent to BHSB's clinical services team, who reviews the referral to ensure that medical necessity criteria is met. BHSB will place the referral on the wait list if there are no openings. When an opening is identified, BHSB will send the referral to the provider, who will then initiate their screening process. A referral can indicate a desired program, but please note that this may lengthen the time on the wait list if an opening is not available with that specific provider. Referrals can be found on the provider forms page of our website, www.bhsbaltimore.org. Completed referrals should be sent via encrypted email to clinicalservices2@bhsbaltimore.org or fax to the number listed here. If you have any general questions about residential rehabilitation program, please feel free to email us at clinicalservices2@bhsbaltimore.org. If you are considering a referral and would like to talk through the specifics of the individual who you're reviewing, feel free to reach out and we would be happy to consult about any potential referrals. Thank you for viewing this presentation.